part of these webinars with this particular guest. For those of you that aren't fully aware, David Schmidt is the inventor of LifeWave technology, is the founder of our company, and also the CEO. And he takes time out of his schedule away from the lab, inventing new amazing things, to come and train us and share his amazing vast knowledge of the human body and how we can optimize our experiences here, utilizing some great techniques, utilizing LifeWave products, and also to just really dive into some important health topics. So today, I'm really excited to share with you through David something that is, I know, near and dear to many people's hearts. A lot of us experience some acute pain or chronic pain, or know people in our lives that experience that as well. And the exciting thing is we have some information here that we're going to be sharing that helps you know how you can help yourself and utilize your body to manage that, as well as people in your life. So David, are you here with us today?
Absolutely. Hi, Emily. Great to see you.
Hi, David. It's great to see you too. Thanks for joining us today.
Oh, yeah. Thank you. And thank you for that very kind and a little bit overwhelming introduction. It's a lot to live up to.
Well, you know, we all think you're pretty awesome. So I do hold it back already. So,
okay. Very kind. Very kind.
Of course.
Thank you.
Course. Well, I'm really looking forward to talking to you today. I was recently at an event with some leaders out in Denver, Colorado, and in talking with a lot of the individuals who were there, they've had amazing relief from some of our products in the area of pain. And so when you agreed to be able to talk with us today about just pain in general, what are some of the things we're facing in the world today and how we can manage that, I was just so excited.
Oh, yeah, it's going to be awesome. And, you know, the interesting thing about pain is, if you want to say that, is that whether or not we describe this with Western terminology or Eastern terminology, the phenomena is exactly the same, but it is a resistance or a blockage to the flow of energy in the body. And one of the reasons to be interested in this, because the route that we've taken with pain relief is to increase energy production in the cell so we can improve tissue conductivity and relieve pain without using any type of drugs. But the overarching direction on this, which is so interesting, and it's the main area of our research today at our labs, is that if we optimize that process of energy production in the cell, it triggers a reversal in the age of the cell, which we've demonstrated. So where this all goes to, you know, you start out with something very simple like pain relief, but the end goal becomes the cessation of aging, and even ultimately a reversal of the aging process, where just by increasing the energy production in the cell, you can get the cell to behave like a younger cell. And of course, a young, healthy cell is in young, healthy body is not going to be one that's in pain. So that can be the immediate benefit that people get, but yet the big picture is an amazing picture.
Well, I love hearing that, because I know that sometimes it can be really discouraging when people are experiencing chronic pain. And, you know, I guess that as we start to kind of dive into the specifics of what is pain, how can we treat pain, how can we use our products to support our body's natural abilities, I just maybe want to start with how common is chronic pain in adults worldwide? Do you know like anything about what people are experiencing right now?
Sure. Yeah, I mean, one thing that people in pain can take some comfort in is that it's extraordinarily common. Right. So every single human being experiences pain at some point in their life, but chronic pain is roughly about 20% in that ballpark. So 1 out of every 5 people suffers with some type of chronic pain. And the important thing here is that pain serves a very important part of our health in the sense that it's a warning system. And we don't want to ignore pain because it could be symptomatic of something much bigger. So this is probably a good opportunity to say I'm not a medical doctor and I'm a researcher, and anything that I may recommend here, somebody should speak with their healthcare practitioner, first. But if we're going to look at something like chronic pain, we should recognize that the pain is there for a reason, right? And this gives us an opportunity to evaluate our overall health. So we should start, regardless, we should start and look at our foundation. What's our diet like? Are we getting enough rest? Are we drinking enough water? Are we indulging in some things that maybe we shouldn't, like too much sugar or too much alcohol, or, hopefully people aren't smoking, and making sure that we're getting exercise, right? That's a good pain. As you know, I know that you're a prominent exercise enthusiast, which is amazing. But yeah, if we're missing any of those foundational parts in our life, it's important that we address that, because then tools like the patches are ultimately going to work much, much better.
No, I really appreciate you bringing that up, because I do feel that a lot of times, to your point, it is a warning system we sometimes ignore, but there's so many components that really go into it. And when you're speaking of the 20% that are experiencing chronic pain, right? Ongoing, consistent pain that's not maybe
right.
specific, or it is specific, but maybe not as easily identifiable. I think it could probably really impact quality of life, right? And even if you are taking care of some of these areas. So, maybe for someone that doesn't experience chronic pain, I know, like you said, 20%, that's a lot of people, but maybe if you could describe for everyone what that actually means.
So now they have.
It looks like we're having a little technical difficulty. Hang on just a second there. But sorry, let's get back to that. But for those that maybe don't experience that, what could chronic pain do to your quality of life? What areas of your life could be impacted?
Sure. Well, first, we'll distinguish this, because an acute pain is something that just comes up. It could be you bump your elbow, you bump your knee, and you get a pain, and it doesn't last very long. Few minutes, few days. Where chronic pain is something more persistent. Maybe it's arthritic pain, that kind of thing. If we look at how the pain cycle initiates and why it's there. So let's say that someone is losing cartilage in their knee, and now you're getting an abrasive action. Maybe it's bone on bone, but there's an abrasive action there. And first, when there's injury to the tissue, we're going to see an increase in oxidative stress. Now, this is actually a good thing. We should frame this that all of the body's response mechanisms are a positive good thing. It's that when we get into a chronic state and we don't take care of our health and we ignore these signals, that's when it becomes a problem, where the oxidative and inflammatory stress can damage DNA, can damage healthy tissue. But the oxidative stress is there to suppress bacteria that could cause infection. It also they act as signaling molecules. They will increase inflammatory stress, and the inflammation there is really there to help initiate the healing process. The inflammatory chemicals will tear down damaged tissue to make way for new tissue, and the inflammatory chemicals, the inflammatory cytokines, attract stem cells into the site of the injury. So now the stem cells can create new healthy tissue. So in a acute injury, that process would go through a natural cycle where intracellular antioxidants would suppress the oxidative chemicals and keep balance in the cell. And the same thing that would help, the antioxidants would help to clear out the inflammatory markers. Everything is in balance, everything is fine. But in a chronic state, let's say someone didn't have a healthy diet and their antioxidants levels got lower. Now, the oxidative and inflammatory stress will make it very difficult for the stem cells to heal the tissue. The stem cells are going to die in conditions of elevated oxidative and inflammatory stress. So now the stem cells can't create new tissue. So that's why this all becomes a problem. But so the way that this affects quality of life ultimately is that someone gets injured and they're not healing. They have to live with the inflammation, with the pain, And, especially if this is an arm or a leg, could have an impact on their quality of sleep, their range of motion, their ability to walk or run, and these types of things. So in any case, this is all resolvable, which is the really good news, is that people that are suffering in pain should not feel as if that, oh, I'm getting older and this is just part of aging, I have to live it. No, we should not. We should never settle for that.
No, I appreciate you sharing that perspective because, as you're describing how this chronic pain can almost work in a cyclical fashion, I can see where people could get a little discouraged and just accepting of this. And I think that's why many of us that have been exposed to LifeWave products get so excited, because we know that doesn't have to happen. Because I think within a lot of cultures, especially here in like the United States and some Western countries, we often resort to medications to get relief from some of these pains that I think sometimes can actually be damaging. Talk to me a little bit about that. What is a traditional kind of Western medicine approach to managing pain, and how is that maybe less effective than some of the things that you've already discussed?
Yeah. So first of all, when someone has an acute injury, let's say someone's been in a very, very serious accident, my perspective on it is that Western medicine has achieved some things that are truly remarkable in the area of pain management and others. When we think about, I had LASIK surgery 20 years ago, and to think that you could be in and out of eye surgery in 10 or 15 minutes it's incredible, right? And the same thing with has to do with painkillers. Someone needs a very, very strong drug. I think that's totally fine. It's that the idea of living off of pain meds is what's so objectionable, because it becomes addictive and it's not addressing, the key issue of what's going wrong in the body. So yeah, problem, of course, that we face today, we've done some work with the VA and as well as other institutions globally. And the big problem that everyone is concerned about is the addiction to opioids, right? So most of the time, the medical doctors, clinicians that they focus on pain management, it's all about what drugs are you going to use and what should the dosage be and why. Certainly physical therapy can play a role, but there are many, many tools that are available to practitioners. It's just that the conventional medical doctor doesn't get trained in how to use those things. And so the patient can't benefit from those other approaches. So most of the time, it's going to be a combination of drugs and physical therapy. And it's okay, but it's really not resolving the issue. It's just masking the problem.
Yeah, I hear that word masking, and I think sometimes that is so true of what people experience. And as you talked about earlier, 1 in 5 adults experience chronic pain globally. And from what I've read recently, in even more developing countries, it's even higher, just for whatever reason. And so I just think we're seeing these increases in synthetic pain management, drug dependency. From the research that you've done, have you seen those numbers continue to grow? And do you feel like it's because of just the lack of additional training on alternative methods?
Yeah, medical doctors and institutions look towards pharmaceutical solutions, it's always going to be based on some type of drug molecule, which is synthetic and always going to produce some type of side effects, when instead the intervention should be things like, okay, let's look at diet. And if we include olive oil or olives, or avocados or macadamia nuts, we have very, very high source of monounsaturated fats, which are anti-inflammatory, which can help to reduce pain naturally. Very, very powerful herbs, extracts such as curcumin, which almost everybody should be taking a curcumin supplement because it's such a powerful anti-inflammatory and helps to manage with inflammation during the cycle of aging. And then, of course, you have omega-3 fatty acids. So by modifying the diet and having fatty fish like salmon, We get a rich source of omega-3s. These are natural anti-inflammatories. So again, these dietary modifications can help to assist in management of inflammation before we ever start any type of drug intervention or anything else.
No, I love hearing you talk about that, because I know that many of us that are on this call today are looking for alternative ways to improve our quality of life and well-being without maybe having those side effects of those synthetic compounds. So I appreciate you sharing that. You know, you've talked to us in the past on other webinars, and you've mentioned these here at the beginning, you know, the sleep, hydration, the types of foods, the supplements, stress management, all work together to really support our body's ability to regulate some of these ongoing concerns. Do you feel that there is any one area that is more important than the other? Or is it really that systematic approach to health that's going to make the biggest difference?
Yeah, I think for each person, everyone's lifestyle is a little bit different. We're all going to deal with stress, right? And things are going to come up. It's how we manage with that stress. Some people, are just going to do it better than others. So it's a question of how do we deal with those kind of things? But again, it's building up the foundation. So we look at and we analyze our diet, and generally I'm a big believer in a low carbohydrate diet, not necessarily ketogenic because it's extreme, but a low carbohydrate diet. We know sugar can be toxic to the system, so it's always going to be preferable to kind of structure your diet in a way that you get as much nutrition as possible, healthy as possible. Incorporate regular exercise. When we exercise, especially resistance training, we're turning on genes associated with longevity, and we're giving our body a healthy stress. And this actually helps our body accommodate to stress that isn't so good, right? When we're healthy, we're fit, we have more lean muscle mass. And by the way, we have something really exciting coming up on that. Won't say any more right now. When we have this as a regular practice throughout our lives, it can help us deal with stress that isn't so good. Getting enough sleep. Again, we need sleep to regenerate the body, to produce hormones that we need, and of course, getting plenty of water. So when we build up that foundation, it's gonna help us enormously. And yet, if you knock off one of those things, if you're not getting enough sleep, or you're eating poorly, you're not exercising, the whole thing begins to kind of collapse in on itself. So it's so important to continually evaluate the lifestyle and have as best the foundation as possible.
I really appreciate your perspective on that. I think sometimes we lean towards areas that are easier for us, right? So sure. You mentioned I love to exercise. So for me, weightlifting, exercising, that's easy for me to do, right? But maybe not having sugar is a little bit harder for me. So I think it's really just evaluating, like you're saying, how am I doing at my overall approach to health? Because they all really support each other, right?
Yeah. Oh, absolutely. And, a good way to look at this too with diet, right? I like sugar just like everybody. I like chocolate. You put a chocolate fondant in front of me, I'm all over it, right? So it's like, use the 80-20 rule, right? So if 80% of the time, you're eating clean, you're getting your fruits and vegetables and having clean food, and then you want to go out with some friends on the weekend or your significant other and indulge a little bit in dessert or a glass of wine or, whatever the person's pleasure is, you don't stress about it because, okay, I've been good during the week. So, having this slice of cheesecake is not going to be harmful. And we should enjoy those things, right? So it's about when we're creating that foundation and we're doing all the right things, we can enjoy one or two cheat days. Put this in perspective. I'll use Sylvester Stallone, right? I love the Rocky movies. I'm a huge Rocky fan, and an incredible guy when you look at where he came from in his physical transformation, despite if he used any type of enhancing drugs to get to his physique, he still had to do an incredible amount of work to get there. But Sylvester Stallone said that he would maintain an incredibly strict diet 5 days per week. And then on the weekends, just eat whatever he wanted to. So if you look at the physique he had in some of his movies, like Rocky IV, for example, yeah, he got there by being strict 5 days a week and having 2 cheat days every week. That's impressive.
It is impressive.
Yeah.
I think what I'm hearing you say, though, is balance, right? Balance and just having a little bit of grace with yourself is going to help this be a long-term lifestyle as opposed to just here and there, right?
Yeah, it's all about balance. It's all about balance, so no need to rehash that. It's absolutely true. Yeah.
Well, I appreciate the perspective on that. I think it's really important that we do have a balanced approach to health, especially if we're looking to manage some of these chronic pain conditions in a more natural way. And I know that many of us here on this call are excited to hear you talk about this next piece of that puzzle or that systematic approach to pain management. And that's our products. Using the patches for many of us has been a transformation and something really wonderful for our health. So would you mind talking to us a little bit about LifeWave patches and how those patches can best support the body in this particular area?
Sure. So let's talk a little bit about first why pain is there in the first place so we can understand how our products work to provide a solution. So, and this works regardless of whether or not it's a chronic injury or it is an acute injury. An acute injury is obviously going to be a lot easier to deal with because in a chronic injury, there's going to be damaged tissue that hasn't been resolving itself. But again, people should know that these things can resolve themselves. And we've seen some amazing things over the years. I met a woman in Sicily, 76 years old, bone on bone. And in 30 days, she had regenerated enough cartilage in her knee where she was out of pain and she was walking just fine. She walked into, I remember this story very well. This was back from in 2008, 2009. She walked into her doctor's office, told her about the patches, and the doctor said, oh, those things aren't going to work. And so she decided to try them anyway. And her son was a LifeWave distributor. And 30 days later, it was a miraculous improvement in her health. She went back to see her doctor and she told her doctor what had happened. And the doctor said, well, I told you not to use those things. They wouldn't work. So she hit the doctor over the head with her cane and walked out of the office. So in any case, what happens with pain? Well, first thing is there's damage to the tissue. There's an accumulation of oxidative stress, inflammation. And if we look at this as the body must have electrolytes in order to communicate, right? So there's communication that's occurring within the cells, within groups of cells, and then through the nervous system, between the brain and the injured tissue. And when inflammation occurs, the distribution of electrolytes in the tissue changes. This will either increase or decrease the resistance in the tissue. This results in a blockage in the flow of bioelectrical energy through the tissue, and the brain interprets this as pain. So this is a feedback mechanism, and it's very important because we don't want to injure tissue that's damaged. So that's why the pain is there. Say, hey, got an issue, stay off that knee so we don't damage it further. So the approach that modern pharmaceuticals has taken is let's block those signals so we can reduce the pain. And in very, very serious injuries, modern pharmaceuticals are fine. We just don't want to live off of them. One thing to consider is that when someone has let's say a catastrophic injury, they'll often say, I don't feel any pain. And then an hour later, they really get hit with it. Well, how is that possible? It's because the body has increased the production of beta endorphins, which are up to 30 times more powerful than morphine. Wow. So our bodies produce biochemicals that allow us to cope with intense amounts of stress and pain until other methods can be put in place. So the idea here is let's work with the body's natural system, reduce the inflammation by elevating antioxidants to protect the tissue, and let's restore the natural tissue conductivity and natural signaling so we can reduce the pain without masking it. So how do we do that? Well, it all starts with the energy in the cell, which was the very beginning, very start of my research. And the idea behind this is we're going to stimulate the skin with specific wavelengths of light that increase mitochondrial function. In this case, it triggers what's called beta oxidation, which is fat burning. We get more energy from fat. The increase in the ATP in the cell increases the electrical charge around the cell. And long story short, we've measured this in our clinical studies, which people can find. They're published studies they can find in the science section of our website. This results within seconds, 10 or 15 seconds, a change in the tissue conductivity and the reduction in pain. That process starts. So this is why when people apply the patches, very frequently, within seconds, they'll say, hey, my pain level is already coming down. And that's because we're doing this bioelectrically and not pharmaceutically.
Wow, that's pretty intense and exciting.
Yeah.
It sounds complicated, but I can see how this approach could work because you're really just utilizing how the body works naturally, right?
Yeah. What's exciting about this is that the more that science discovers about the mechanics of the cell, the machinery of the cell, the more that we take step forward to change the way that human beings age and the way human beings heal. So we've had I'm not ready to talk about it today, but even just within the past couple of days, we've had some very interesting results in our lab. But one of the things that we're learning how to do is use technology that we've created and patented to inductively charge the cells with energy so they carry more electrons. These electrons result in an increase in the biochemistry of the cell, the ATP, NAD, NADH, energy carrying molecules in the cell. And so we can exceed the natural limits that exist in the rate at which we heal and ultimately slow down the aging and even reverse the aging process in the cell. So this is all to say that if we want to have a very powerful method of manipulating the way that we heal, controlling pain, it all comes down to how energy is created and how energy flows through the cell.
Wow, that is so incredibly interesting. I mean, gosh, every time I hear you talk about how these patches work and the technology that you're researching, it blows my mind because it just sounds like science fiction. But when you hear what you're sharing is specifically about what it's doing within the body, it all makes sense.
Yeah, so my son is 23. And the conversations that I have with him today is I'll say, hey, you've seen this new technology that he's working in our labs, by the way, as a lab technician, and he's doing great. I'm really proud of him. And I'll say, look, we're creating this technology. This is what we show in our studies. So the premise is by the time before you're 30, you may not age anymore. And, what do you think about that? He's like, it's really cool, but it's just so hard, to wrap your arms around. And, but that's the type of work that we're doing. And I certainly see it as achievable because we see it today in our labs.
Well, I think that's the exciting piece for those that are interested in reading about the actual results of the studies that you've done and really diving into all of the technical pieces. That's all available on our website, like you shared. And so anyone that's interested in really understanding the nitty gritty can really get in there and see that. And I think that's one of the things that's so wonderful about what you've been able to create here, David, is we have these tools, these beautiful patches that do incredible things, but they're backed up with information that literally prove it. And that is just not very common.
No. Norm Shealy, who is one of the researchers that we've worked with over the years, incredible guy, medical doctor, neurosurgeon. He said to me one time, LifeWave stands alone in the volume and the quality of the research that we've done over the years. There's a very interesting study that we have. We have, I think, 18 clinical studies that we've done over the years on pain management. And we did one study with Dr. Pierre Volkmann in France. That's an incredibly interesting story. But the net end outcome is we have a study that's on our website, 100 people, double-blind, placebo-controlled. And the outcome of that study was that by just applying our patches, people got 65% reduction in pain. And this was from a very simple patch protocol. The doctors were not allowed to move around the patches and even follow our instructions. They just put the patches onto the body to see what would happen. Even just doing that, 65% reduction in pain in 94% of the participants. I challenge anybody to find a drug that is that efficacious without any side effects. The drugs don't exist.
Wow. Those are pretty impressive results. And I bet everyone's going, okay, well, what patches are they then? So I guess let's take it to the next step. As people are looking for a way to really be able to manage pain, help people that are struggling with chronic pain, what patches do you recommend? And I know you've spoken about this before, but is there kind of like what's the right word? A path someone could follow, like a progression to make sure that they're getting the relief they need?
Absolutely. And so one of the reasons why it was important for us to go through all of this stuff in the beginning is so that people can get the best results possible by understanding how pain occurs in the first place. We can select the correct combination of products to match up with whatever that person is dealing with. So again, the first thing is if someone is dealing with chronic pain, let's say for the sake of example, it's arthritis. That person should work with, let's say, a medical doctor who's a clinical nutritionist or just a nutritionist. There are many excellent naturopaths that could do this. It's up to them. But first, get things like diet, exercise, sleep, get all those things in order so you have that foundation and you're getting all of your proper nutrition. The first product I would start with would be IceWave. And we have plenty of clinical studies showing that just IceWave is enough for most people to get adequate pain relief. And the mechanism of action there is to elevate energy production in the mitochondria, do that as a means to improve tissue conductivity, and pain and inflammation come down. So that would be a good place to start. If it's localized pain, you could put the patches next to one another around the area of pain, like parallel to one another around the knee. Or if it's a systemic pain, you could apply one set of patches on the bottom of the feet, maybe a second set up on the shoulders, and very often that's enough. The second patch I would go to, or if somebody actually wanted to start with Eon, that's another way to go as well. And the reason we'd use Eon is that it's a very powerful anti-inflammatory. It triggers reactions in the cell where we get an increase in an antioxidant called superoxide dismutase, or SOD. And by elevating intracellular antioxidants, we're going to help to suppress oxidative stress and inflammatory stress so the inflammation comes down. So either Eon by itself or the combination of Eon and IceWave would be very powerful. Now, beyond this, there's some very interesting options. When people suffer with diseases like arthritis, Parkinson's disease, MS, we're going to see a deficiency in glutathione. So I'm not claiming that elevating glutathione is a cure for these diseases and that our patches do that. What we're just talking about is pain management, just to make this very, very clear. So if someone was suffering with a health disorder like Parkinson's, MS, arthritis as some examples, where these chronic diseases occur over a period of time because the antioxidant systems are stressed. Elevating those antioxidants is going to help to provide better management of pain. So glutathione patch is a very, very good option in those cases. If someone is suffering with pain associated with the muscle tissue, the carnosine patch that we have can provide relief of pain. So that's an interesting option that people have available. X39, which I know most of our members use, can help manage pain, but X39 is interesting because it will manage inflammation, but because it's elevating copper peptide and activating stem cells, the stem cells need inflammatory chemicals because that's what attracts them to the site of injury. So if someone's dealing with chronic pain, I would use X30, and it's associated with an injury that won't heal. I'd use X39 with Eon, and X39 could be placed, let's say, below the belly button, and then the Eon patch at the site of pain to lower the inflammation there. So there's a ton of options that are available. That's the good news.
Well, I really appreciate you sharing a few different ways that people can use a lot of our patches to have some relief. I love what you just shared here at the end, though, specifically with X39 to start, Eon at the point of pain, and then maybe if you need a little extra support, maybe Ice Wave on top of that. Is that something you'd recommend?
It all depends on what people are dealing with. I would say a very simple protocol. X39, back of the neck, Eon at the point of pain is a great start. If the pain is systemic, so let's say it was arthritis as an example, then they might want to add to that Ice Wave on the bottom of the feet. And that could work very, very well.
Oh, I love that. Yeah. I really appreciate that. You know, one thing that you've talked about already and that we get a lot of questions about is water, right? We talk about how water is so important to use with the patches. Do you mind just sharing a teeny bit more why water is so important to make sure that the patches are working at their full capacity?
Yeah. So when we go back to the premise of how the patches are working in the first place, it all relies on the ability to stimulate the skin with light. That signal triggers an increase in an improvement in mitochondrial function. And so now we get more energy in the cell, and now the patches, the signaling mechanism can work to do other things. So we need a couple things. We need oxygen. We have to be breathing, right? Getting oxygen in our body. We have to have a food source, which isn't a problem, especially here in the United States. And then we need water, right? And so very significant problem is that as people age, the body becomes dehydrated. And this means the cells are shrinking and the ability to get water in and out of the cell becomes more difficult. So detoxification becomes more difficult. But creation of energy, we need water to create energy in the cell. So most people today, they don't drink enough water, and this can impair energy production and detoxification. So I've seen many times over the years, I know we have groups where they train people, especially in California, they'll train people, hey, drink a glass of water first, then use the patches. You don't have to do that, but the idea is simple, that most people aren't drinking enough water. It can impair results. So yes, pay attention, make sure you're getting enough water.
Oh, I appreciate that. I do have a couple more questions. We're almost out of time, but these are things that I've heard from a lot of members recently, and I think it relates specifically to this. So, with this strategy, I know that a lot of people will start to feel better right away. We've talked about that. People a lot of times have an immediate reaction to X39, to Eon, to Ice Wave, to a lot of these products that you're talking about. But I also know specifically with X39, sometimes people don't feel something immediately. And it can take a little bit longer. Why is that? Especially if you're maybe focused on pain. Why would that happen?
Yeah, it could be any number of reasons with any of the products, right? So first thing is our clinical studies. When we have a number of published studies on X39, we'll do bioelectrical testing. We do blood testing, of course, urine testing. So we know that we hit statistical significance, and the vast majority, let's say it's over 90% of the people that use the product, we will see biochemical changes in their body. Not everyone is going to feel that. It's like if you take a vitamin pill, you know that the vitamin is healthy and good for you, but you're not going to feel those B vitamins, going to work in your body, right? So some of that has to do with that. The other thing is that the body can prioritize what gets healed first and why. And this can have to do with the level of inflammatory chemicals at a particular site. So a good practical example of this is we've had members that have said, oh, I wanted to use X39 to heal my knee. And after a month, I didn't notice anything. But then I realized this other pain I had in my shoulder is now gone. So those things can happen. In a smaller percentage of people, it comes back, maybe they're not drinking enough water, maybe they don't have the nutrition that they need to drive the healing process. And this is why we really want to help to reinforce the idea of, if we want to repair an injury, if you don't have essential fatty acids, protein, enough water, the vitamins, coenzymes that are necessary to heal, using any product is not going to work. So in a small percentage of people, that can be at play as well. So yeah, I think that addresses it.
No, it absolutely does. And I love the concept of that your body will prioritize what it needs first. Like it's almost like that triage kind of concept. What's the most important need first? Even if we feel like the pain is the thing that we're struggling with, but it may be the biggest issue, right?
That's right. There could be an underlying health issue. So, yeah.
No, I appreciate that. Okay, last question. It really does relate to X39 and then relief from some of the products. So I've had some questions. Is it possible that someone might have relief when using the product, but then like that chronic pain might resurface? If that happens, what should someone do? Can someone overuse the patch? I mean, what could cause that?
Yeah, no one, so the patches can't be overused per se. Sometimes what people do is they will leave the patches on more than the 12 hours that we recommend. And that's definitely a no-no because in light therapy, it is very well known that if you overstimulate the skin with light, the body stops responding. So one important thing to do is make sure you're putting the patches on, let's say 8 to 12 hours, and then removing them. Don't leave them on because eventually the body is going to stop responding. Another thing that can happen, of course, is the tissue can be re-injured. Someone's not getting enough rest. You have one night of bad sleep that can really throw everything off. So yeah, it's hard to make a general statement about it because everyone's situation is a little bit different, but could be, multiple reasons. So I would, again, people should be looking at what's their diet. Did they eat something that perhaps they were allergic to? There's, food allergies are very common, drinking enough water, getting enough rest. They can move the patches around and try that and so forth.
No, I appreciate that because I know that people have had such amazing results using this, but I love that you are really helping us to understand that this is a part of health, right? This is a part of supporting optimization for our bodies, is that holistic approach, that whole everything together, the sleep, the food, the everything in conjunction so that our bodies can work at their optimal levels. That's awesome.
Yeah. And, it's, I'll use another example. This is not necessarily on the subject of pain, but it's certainly a subject to health. So I get my blood work done every couple of months because I'm constantly experimenting with new things. And I turned 58 this year. So one of my fun things to research the past couple of years has been testosterone. And I've been crazy successful at finding natural methods of elevating testosterone. So my testosterone levels are in the upper 700s at this point, which is, normally be a guy in his late 20s, early 30s. Yeah. And so one of the things I was experimenting with was elevating cholesterol, and which we don't think of, as being a good thing. And I pushed my cholesterol levels over 300. And I was like, all right, well, I didn't really want to do that. And I got the results back. My doctor's like, well, what do you want to do about this? We should, take a look at some interventions. I'm like, no, I'm fine. I got it. And so I just simply added 2 tablespoons of olive oil to my diet. 3 weeks later, I went back and I got tested again, and it was like in the low 200s. It was back down into normal range. And he's like, how did you do this? I was like, with olive oil. He's like, you got to be kidding me. So, yeah. And unfortunately, most doctors are not going to have, it's a disservice to them, to medical doctors, because they don't get the proper training in nutrition unless they elect to become a clinical nutritionist to provide a full picture for their patients, right? So I am not knocking medical doctors. It's just kind of the system of indoctrination. But the whole point to this is that everyone is going to be faced with some type of health challenge during the course of their life. It's just part of being a human being. The exciting thing is that there are always natural options that can help people with whatever they're facing. It could be something as extreme as cancer. There's natural solutions.
Oh, I love knowing that, because I think a lot of times it can be overwhelming, can be scary, but I really appreciate what you've shared with us here today. Being that 1 out of 5 people experience chronic pain, that there are things that we can do that are in our control, that we have access to here through LifeWave, that can allow us to really impact that area of our lives. And like you've talked a lot about, reverse our aging, help our bodies to just function so much better. So I appreciate it.
Yeah. And ultimately, Emily, I hope, let's say 5 years from now or 3 years from now, whatever it is, you and I aren't talking about pain relief anymore, because the age reversal system is on the market and people don't have pain. They can just use the age reversal system, and that they're going to have bright, shiny, healthy young cells that are vibrant and not subject to pain. So that would be the goal.
Well, I appreciate the work that you're doing. I know so many appreciate what you're doing. I hear from members all the time about how excited they are and appreciate what you've dedicated your life to. Thank you for sharing with us today your knowledge and teasing us a teeny bit on some new things coming out.
Yeah, more to come. Yeah, more to come.
Well, thank you so much. And thank you to everyone that's on the call today. We appreciate you taking time out of your schedule to come and learn. I know that we all appreciate David's time, and I hope that today